Warm welcome to today's talk. It's Friday the 7th of January. Hope you caught the last video on the change of poster because it's no longer possible to stop Omicron. So we've changed to this new infographic poster. Now today I want to look at the surge of cases in the United States and the United Kingdom. This is unstoppable. We can modify it a little bit. We could slow it down a bit. It'll take longer to get around everyone, but we can't stop it now. This Omicron wave is now inevitable that we are all going to be exposed to it. Many of us won't suffer from it. Many will be asymptomatic. The vast majority will have minimal disease, most often as a common cold. Some people will feel pretty sick for 2-3 days. A minority of people will require hospital care. But that's what we're looking at today now. Let's look at some data first of all. So here we have the world cases. This is from Our World in Data. This is all over the world, the whole world, and we can see there's a big Omicron spike, bigger than any of the previous waves by quite a long way, as we've said, everyone in the world is being exposed to Omicron. This is deaths. As the Omicron cases have gone up, deaths have gone down. So we see the high deaths in previous waves, and now we see that deaths are still declining in this age of the Omicron variant. New daily confirmed COVID-19 cases per million. Well, we do see this upward trend. And this is going to continue for about another 2 weeks is what the data is showing. Another 2 to 3 weeks is going to peak at the end of January. Then hospitalizations are going to peak in February. And that's looking fairly sure now. I think we can say that with some confidence. But let's carry on sticking to the data. So increase in cases. Remember, this is diagnosed cases rather than infections. Diagnosed cases being a subset of the total number of infections. Canada, Netherlands, United States, Netherlands bounced. This here in Netherlands was Delta, so they've come from Delta straight onto Omicron. United States, Omicron, Australia, Omicron. Interesting now, cases in Australia. Despite the difficulty of testing in Australia, but there again, there's difficulty in testing in America. So these cases in Australia and the United States are gross underestimates of the actual number of infections because of the great difficulty with testing logistics. But despite that, these are actual diagnosed cases. So the real numbers we can say are at least twice as high. United Kingdom, now cases are still going up in the United Kingdom, but not going up as quickly. That's the key point. Ireland still remarkably high. And of course, Ireland is a highly vaccinated nation and yet with very high numbers of diagnosed cases. Hospital patients, Netherlands still going down as it recovers from its Delta wave. Australia is going up, but it's not that high in Australia yet. It is going up though. Ireland data still somewhat incomplete. Canada, somewhat of an increase. United Kingdom, it's increasing. It's not at critical levels yet. The main problem in the United Kingdom, and the reason why the 200 military personnel have been drafted into hospitals in London that I've heard of so far, is because of staff sickness. This is the real problem. So many staff are isolating. And about half of the staff that are off sick are isolating because of Omicron exposure. So this is the real problem at the moment. United States hospitalizations have remained high and have gone up, and this is partly because of the comorbidities in the United States and the obesity and unmanaged hypertension and other chronic problems like that often not that well managed in many segments of society in the United States. Now this graphic here is the reproduction rate, the R number. Now here's one. So anything above this, numbers are increasing. So as we can see, numbers are increasing. Now, even when the line starts to go down here, as in the case of the United Kingdom, this is still a positive R value. So this represents still an exponential increase in cases. It's just the rate of increase is not as rapid. So the R value is down from about 1.4 to about 1.2 or thereabouts. But the cases are still increasing, just that the rate of increase is not as dramatic, but they are still increasing. So we can say the cases are going to carry on increasing. We believe, at least even if the line goes down to here, the cases will still be increasing because it's got to go below this line here for the cases to start decreasing. So Netherlands will carry on increasing. United Kingdom will. Canada, again, the rate of increase has gone down somewhat. Ireland and the United States, the rate of increase has increased. And Australia, it's flattening off according to that data. People in Australia are very keen to tell me that the approach in Australia is very different in different parts. It's the New South Wales, Sydney area that seems to be saying let it rip, whereas other parts of Australia are being more conservative. Now let's just go on to look at some data now from the United States. New York hospitals, how this is transposing into hospitalizations. Well, incidental positives, in other words, people that are admitted to hospital and found to be positive for Omicron for other reasons, are 50% in some hospitals in New York and up to 65% in others. So quite variable. So this emergency care physician, we're seeing an increase in numbers of hospitalizations, but the severity of the disease looks different from previous waves. This is not as severe as previous waves. Dr. Shamira goes on, we're not sending as many patients to the ICU. We're not intubating, putting tubes down the trachea as many patients. And actually most of our patients are coming to the emergency department. They get tested and basically they get sent home. So that's pretty good news, really. So these cases are not transposing into hospitalizations the way they have done in previous waves. Now I want to look at some more data from the United States now, which gives projections. This is from the Institute of Health Metrics and Evaluation, reference given, of course. So daily infections, this is roughly where we are now. So we can see they are going to carry on going up. This assumes 85% of the population wear masks. I don't think the effect will be as dramatic as that with Omicron, to be quite honest. But that's their modelling. So this is basically what's going to happen. So cases are here now. They're going to go on increasing up until what? About the third week in January. So by the 1st of February, the number of cases, not the rate of growth, the actual number of cases in the United States will be declining, and it will go on declining throughout February up until the 1st of March, and then by the 1st of April, the cases will be declining even further. Hospital use in the United States, how's that going to pan out? Well, again, it's definitely going to go up. And this model actually thinks there's going to be an increase in ICU bed admissions. Now, so far, this is not what we're seeing. It's not what we're seeing. So let's hope this is overly pessimistic. Again, a close-up on that. Overall hospitalisation, so we're looking at maximum increase in cases here, end of January, maximum hospitalisations, middle of February, then pressure is going to ease. So make no mistake, there is going to be a fairly difficult time in terms of hospitalisations in the States especially. And we've seen that hospitalisation in the States have remained high. Deaths in the United States, again, an optimistic scenario. This scenario here assumes that Omicron is going to be quite severe, but I don't think that's going to happen. So this is roughly where we're going to get. There's going to be some increase in deaths up to around about the 2,000 a day mark, and then it's going to fall off to into April. And again, that's a closer up view of that. So maximum deaths are going to occur in the middle of February in the United States. And I think this will be the last winter, but it's going to be a difficult one in the States, certainly in the States. Just to give a couple of localized illustrations. This is California. This is California, the increasing cases in unvaccinated, but vaccinated cases are increasing as well, of course. That's the data from California, increasing cases. This is the data from New York. Now, this is percentage here, and this is total numbers on this side. So these grey bars here are the delta. So we can see that the size of the delta bars are getting smaller. In terms of percentage, yes, but in terms of overall numbers as well. So the latest data we have is that delta is only about 4% of cases here in New York. That's the latest data we have there. That means all these cases are Omicron, and that represents 95.7% of cases are now Omicron. So because the Omicron bars are getting bigger and because the Delta bars are getting smaller, we can now definitively say that in the United States, as was the case in the United Kingdom, that Omicron is replacing Delta. And of course, this is remarkably good news. This is exactly what we would want. Latest data from the UK. If someone's had 3 doses of vaccine, their chances of being hospitalised are 88% less than someone who's not vaccinated at all. But of course, virtually everyone's got some antibody exposure in the UK now, so not many people would have that relative risk. Now, I want to look at some data from the Office for National Statistics. That's this one here from the UK. This has just come out today. And this shows the difference in age ranges. So we've seen a big increase in the 12 to 24-year-old age groups. The 35 to 49-year-old age groups flattened off. The younger age group, 25 to 34, flattened off. But we are seeing now an increase in the 50 to 69s, projected here. As we can see, this is projected to carry on going up. And of course, this is one of the groups that are more prone to hospitalisation. And likewise, in the oldest age group, again, projected to go up. So this is quite a strong proviso, really, that the cases so far in the UK have been mostly the younger age groups. So how are we likely to fare altogether? Well, so far, as we more or less predicted, the London data, which of course is leading the way in the UK, is closely mirroring the South Africa pattern 3-4 weeks ago. We did anticipate this. We had provisos around it, but it does seem to be following it. So let's look at the South Africa data. Cases, so B11 wave, the original Wuhan virus, the Alpha wave, the Delta wave, and the Omicron wave, right up, but then down really quite quickly. And this is genuine. The cases are dropping off like this in South Africa. Now, how is this transposed to death? So that's the first wave, second wave, third wave, fourth wave. Let's look at the deaths. Well, there we go. Let's just flick back again. That's the Omicron wave there. That's the deaths. So we see deaths for the B11 wave, the first wave, the second wave, the Beta wave, the Delta wave, and the deaths for the Omicron wave remarkably low. Now, there will be a few deaths still to come, but we believe not that many. So this is the very low levels of death induced by the Omicron wave compared to the Delta, compared to the Beta, compared to the original Wuhan strain. I think that really kind of, zooming in on that graphic, kind of brings it to life a bit. Very low overall death rates. And let's just check on the hospitalisations in South Africa. Well, they are well down. So this is virtually complete data now for the first week in 2022. That is complete data from the last week in 2021. So we see the peak there, down on week 51, week 52 the last week, down, first week of the new year, down quite significantly. This, as I say, this may go up a little bit. These different colours represent private and public sectors in South Africa. I can't remember which is which. But these are the overall levels of hospitalisation. So relatively good. And if we look at the people actually in hospital at the moment, again, this is today's data, currently in hospital, under 9,000 diagnosed with SARS coronavirus 2 in South Africa. And we see the numbers for intensive care and high care. 1,300 people in the entire country of South Africa currently requiring oxygen. Just incredible. Very, very low. And we know about half of these patients in South Africa that are hospitalised we were just discovered to be positive when they were hospitalised for other reasons. Cases in the UK. So R is about 1.1 on this data up to the 3rd of January. Here's the increase. Now we can see that the increase here was sharpest because the line's going up steepest, and you can see that the dots are further apart. Now the dots are closer together, so it is still increasing, but the rate of increase has decreased. So the R value is probably still 1.1, so that is clearly an increase, but a slower rate of increase. Now, this is new cases amongst doubly vaccinated people in the UK, amongst all people. Now, this is not vaccinated versus unvaccinated. This is 2 doses of vaccine at least versus everyone altogether. So these people are a subset of this total one here. But what we clearly see is people that are doubly vaccinated are getting symptomatic infection to the tune of, well, what's that? That's to the tune of 90,000 a day. They are, and of course, this study is dealing with symptomatic infection. So clearly, vaccinated people are getting symptomatic infections. But having said that, the total number, which includes the unvaccinated, of course, are getting more infection. So we see some protection against symptomatic disease. But we still believe that the people that are doubly vaccinated, even though they're getting symptomatic disease, is the symptoms aren't as bad and they don't last for as long. Now, this is also interesting, and this is the main cause of concern at the moment. This is the big unknown at the moment. Age groups. So we know it went up in the 18 to 35 quite dramatically. We saw that here. But up until recently, this line here is the 55 to 75. That's actually went down a bit, but now that's going up, as it is in the over 75s. And of course, these are the groupings that we believe are more likely to go to hospital. So we could see a pressure from this age group on hospitalizations. Although so far the data we're getting is that it's not a huge problem even in older people. Nothing like compared to what it was anyway. So that's some interesting data, peaking soon in terms of number of cases in the next 2 or 3 weeks in the UK, in Europe and in the United States, but carrying on for some time after that, but the number of new cases starting to decline after that point. But there's still going to be plenty of us getting in. Most of us are going to be probably infected by January, but still quite a few of us getting infected in February, March. So just be ready for that.